The direct stimulation of the muscle takes place via alpha motor neurons. This means that a normal muscle response can be recorded. If the current intensity is further increasing, a blocking of the H reflex takes place as a consequence of the repolarizing effect of the stimulus anode. The results table show how the H amplitude firstly rises and then declines parallel to the increasing current intensity. Blink reflex. The measurement of the blink reflex is used for the following: diagnosis of the reflex arc after stimulation of the nervus supraorbitalis, switching of the reflex in the sensitive trigeminal nucleus, as well as in the motor core areas of the nervus facialis inside the brainstem, and finally, in the recording of the monosynaptic and the polysynaptic reflex muscle contractions at both musculi orbicularis oculi. The recording of muscle responses following supraorbital stimulation takes place with the patient lying down with his eyes closed. On occasions, better results can be achieved with the patient's eyes kept open. Useful instrument adjustments have already been specified in the examination program as follows: sensibility 100 microvolt, time base 20 milliseconds per division, stimulus duration 100 milliseconds. The frequency filters are stored in the setup of the Neurowerk EMG. The program is 2-channel preset. The active electrodes are attached to the orbicularis oculi muscle, which is right below the eyes. The respective reference electrodes are mounted at the nasal wings. The ground electrode is attached to the nose bridge or on either arm. It is stimulated by placing the stimulating electrode in the middle of the eyebrow, above the ophthalmic nerve, which is the terminal branch of the nervus supraorbitalis. The examination must always contain a left-sided and a right-sided stimulation series. Since the reflex habituates very quickly, the stimulation should occur very slowly and not in a rhythmical manner, and possibly no more than once every 10 seconds. In addition, the stimulus should not be pre-announced. Stable reflex responses may be expected with stimulus intensities between 10 and 20 milliampere. We recommend that approximately 10 reflex responses of each stimulation site are recorded, which are illustrated in a superimposed manner. It consists of an ipsilateral early monosynaptic and late polysynaptic reflex response. On the respective contralateral side, only the late polysynaptic reflex response can be obtained. Visual evoked potentials, VEP. Visual evoked potentials, VEP, are measurable electrical potential fluctuations that are recorded in an occipital manner above the primary visual cortex. These are caused by a visual stimulation of the eye, retina. This stimulation occurs either through light flashes or a so-called checkerboard pattern with contrast reversal. The VEP examination should always take place with the patient sitting down in a comfortable position. Unnecessary muscle artifacts are avoided by a calm head position, pillow, neck roll, etc. A quiet and darkened room is required to ensure a good VEP recording. The instrument settings for the VEP should be selected as follows. Amplification, 4 to 20 microvolt per division. Time base, 20 milliseconds per division. Lower limiting frequency, 1 Hz. Upper limiting frequency, 200 Hz. The limiting frequencies at Neurowerk EMG have been stored in the setup settings and cannot be directly changed. Obviously, the device settings should be configured to suit the particular diagnostic requirements. Visual evoked potentials usually take place on one channel and by using pattern reversal stimuli. The stimulation occurs through a steady switch over of light and dark squares, which is the so-called checkerboard pattern on a monitor. It is recommended to place the stimulation monitor on a height adjustable table, bracket, to position the monitor accurately at the eye level of the patient. Throughout the entire examination, the patient has to fix his eyes on the fixation point. This is in most instances a red cross or point which is located in the middle of the stimulation monitor with the stimulated eye. The VEP examination requires the full attention and concentration of the patient. Otherwise, a successful examination will not be possible. The reference electrode is the electrode position FZ. The active recording place on the one-channel examination is the position located 3 to 5 cm above the inion that corresponds to the OZ electrode position. Surface electrodes are used for recording, and these are attached to the corresponding positions by using adhesive paste. To realize good recording results, attention should be paid to ensure that the contact resistance between the scalp and the electrodes is less than 5 kΩ. The grounding can be attached to the wrist or on the CZ electrode position. By using the Neurowerk EMG, the patient has to sit at a distance of 140 cm to the VEP monitor. The monitor should be at the eye level of the patient. Please check your manual to verify the distance that the patient should be to the monitor by using different checkerboard patterns. If your patient wears spectacles, he should also wear them during the measurement. Both eyes are usually stimulated separately, with the non-stimulated eye being covered with an eye patch or something similar. The potential is averaged 100 times and has to be reproduced at least once, that is, must be shown again for a quality protection. The reproduction will start automatically through the system. Subsequently, the measurement takes place on the left side, which means that obviously the eye patch must be changed accordingly. Once the measurement of the left side has been completely finished, the markers, if they were not placed correctly by the program, will be scrolled manually. The measurement table displays the latencies and amplitudes of the marked peaks for both the left side and right side. Auditory evoked potentials, AEP. The auditory evoked potentials are classified according to their latency in early, middle, and late AEP. Auditory stimuli are transmitted through the middle of the ear and trigger nerve impulses inside the ear, which reach the brainstem through the auditory nerve. Potential fluctuations which arise in the brain via auditory stimuli can be measured to the scalp. Further switching stations serve the processing of signals. The signal processing causes typical measurable potential changes in a time-displaced manner. auditory brainstem response or brainstem evoked response audiometry. The AAP examination should always take place while the patient is lying down and in a comfortable position. Unnecessary muscle artifacts can be avoided by relaxed head position, for example, by positioning the patient's head on a pillow or a neck roll, as well as by closing his eyes and keeping his mouth slightly open. Instrument adjustments for ABR should be selected as follows. Amplification, 0.2 microvolt per division. Time base, 1 millisecond per division. Averaging steps, 2000. Stimulus frequency of the alternating click stimuli, 11 per second. Volume right ear, 70 decibel higher than hearing threshold level. Volume left ear, 50 decibel higher than hearing threshold level. Lower limiting frequency, 300 Hz. Upper limiting frequency, 3000 Hz. The limiting frequencies are stored in the setup settings of the Neurowerk EMG and cannot be directly changed. Obviously, the device settings should be configured to suit respective diagnostic requirements. The active or different electrode for stimulation on the right side has to be attached to the right processus mastoidus. In this instance, a black cable is used. The active or different electrode for stimulation on the left side has to be attached to the left mastoid process. In this instance, a green cable is used. The CZ electrode position acts as a reference or indifferent electrode, in this instance assigned by a red cable. Before electrodes are adhered, it is advisable to prepare the skin with an abrasive paste to ensure a low contact resistance. The recording electrodes are connected to the corresponding jacks of the common cable. Following the successful application of surface electrodes, the examiner will provide the patient with headphones. For most headphones, a side label is provided which avoids the interchanging of the right and left sides. At the same time, attention should be paid to the fact that electrodes that have already been applied should not slip following the headphones being put on. Subsequently, the impedance measurement takes place. To ensure a proper recording, a resistance level of below 5 kΩ is desirable. The hearing threshold assay must be conducted separately for each ear. It is recommended that the stimulation intensity is gradually increased and reduced within the expected audible range until the patient indicates that he is just hearing the sound marginally. The final stimulation intensity for the right and left ear is issued automatically by the Neurowerk EMG after determining the threshold of hearing. The contralateral side is masked with a noise level that is 50 decibel above the hearing threshold. The registration of the ABR starts with the analysis feature. For an applicable measurement, the potential is averaged 2000 times. If the potential size is displayed in character that are either too small or too large on the monitor, the imaging sensitivity can be adjusted while measuring. Each measurement should yield the same result at least twice to ensure the reproducibility of the curve. The measurement of the left side is conducted according to the right side and starts automatically. A repositioning of the electrodes is not necessary. This is implemented internally and machine-aided by the system. Once the measurement of the left side is completed, the markers, if they are not correctly set by the program, can be moved manually. The table of measurement shows the single wave latencies and intermediate wave latencies of the marked peaks for the left side and the right side, as well as a comparison with the indicated standard values as a graphic. Somatosensory evoked potentials, SSEP, of the median nerve. Somatosensory evoked potentials, SSEP, are induced via electrical stimulation, that is, evoked nerve action potentials. These action potentials are recorded not only cortically, but also spinally along the spine. The implementation of the somatosensory evoked potentials is basically similar for all nerves that are available for this examination. Therefore, it is recommended to first carry out the examination using the example of the median nerve. The techniques shown and described herein are essentially repeated in all other nerves, particularly when it comes to the basic application of the stimulation and recording electrodes. The instrument settings for the SSEP of the median nerve should be selected as follows. Amplification, 2 microvolt per division. Time base, 5 milliseconds per division. Stimulus duration, 200 microseconds. The limiting frequencies at Neurowerk EMG have been stored in the setup settings and cannot be directly changed. Obviously, the device settings should be configured to suit the particular diagnostic requirements. The SSEP examinations should always be performed with the patient lying down in order that muscular relaxation can be achieved. Through the patient closing his eyes and slightly opening his mouth, there will also be a reduction of muscle artifacts. The attachment of the recording electrodes, in this case gold cup electrodes, might take place while the patient is seated. The skin on the recording plate is first exposed and disinfected with alcohol. If necessary, the skin surface should be prepared with an abrasive skin cleaning paste. The application of the surface electrodes takes place through a conductive adhesive paste that must be attached tightly to the skin without there being any entrapped air. In the 4-channel SSEP recording of the median nerve, 4 different or active electrodes, in this instance with black cables, are used. The C3 stroke recording place, which is on the opposite side to the C4 stroke place, results from the basic statutes of the International 1020 system and corresponds to channel 1. Starting from the CZ central point, it should be measured 7 cm to the temporal to determine the C3 point. From the C3 point, it should be measured 3 cm to occipital to receive the C3 stroke recording place. The first spinal recording place is CB2. It is here that channel 2 is positioned 4 to 5 cm below the inion. CB7, which is channel 3, is placed between the spinous processes 6 and 7. The Erb's point corresponds to the 4th channel and is determined 2 cm above the center of the clavicle. FZ and the beginning of the sternum are used in this examination as references. In this case, red wire is used. FZ is placed as a reference for channels 1 to 3. By using jump leads, reference connections for channels 2 and 3 are hot wired to the port of channel 1 to FZ. For the fourth channel, an additional reference is pasted to the beginning of the sternum. Subsequently, the impedance measurement takes place. The resistance should be below 5 kΩ. The stimulation place for the SSEP of the median nerve is determined in the same way as is the case with the electroneurography of the aforementioned nerve. Therefore, it is above the median nerve at the wrist. It should be noted that the cathode of the stimulation electrode points to the proximal, towards the head. The ground electrode is attached between the stimulus and recording electrodes. It should be noted that these should always be moist and tight-fitting. The stimulation starts with low stimulation intensity and increases slowly while the stimuli are triggered cyclically. It is stimulated for as long as a motor response can be seen on the thumb muscles. This will result in the stimulation intensity becoming increased by a further 3 to 4 mA. If due to a disease the motor response fails to appear, the sensory threshold, the intensity when the patient senses the stimulation for the first time, should be ascertained. In this case, it is necessary to stimulate with the triple sensory threshold. After determining the desired stimulation intensity, the signal is averaged 200 times. Each measurement should take place with the same result being yielded at least twice to ensure the reproducibility of the curve.